My name is Beth. I'm a dietitian and diabetes educator with Gem Care Wellness, working with Edwards Healthcare Services today in regards to our CoreVantage program. So we're going to do a little uh, just talk about continuous glucose monitors, insulin pumps, kind of choosing the right tools to work with your lifestyle. So anybody with diabetes knows that you are typically connected to so many different things. So it is just, kind of finding the right tools that work for you. So hopefully what we're going to do today is, have a good understanding of just some diabetes technology, an overview, no specific products, but just kind of what all the different tools will do for you, why diabetes technology can be so impactful, the difference between using finger sticks and a continuous glucose monitor, your insulin pump options out there. There are many. It's a super exciting time in the world of diabetes management. There are so many new tools, technology, hopefully to make your life easier. We'll touch on implantable continuous glucose monitors, how we use technology to help with nutrition and lifestyle support, and just kind of helping make everyday decisions around your food. We are also going to have Allie Baker, who works with Edwards Healthcare Services, and she is a type 1 diabetic, and she's going to tell us a little bit about some of her journey and why she chose what she chose at the end of our presentation here today. So hopefully this will be helpful for you. So what is diabetes being connected? What does that mean? It helps you make decisions. Kind of gives you that constant feedback of what is, what's going on and how to make it easier. It can help you just make when you choose a food, what's going on. You can look at your blood sugar a couple hours later and make some good choices there. What technology doesn't do is it doesn't remove the responsibility of diabetes management, but it can help make it easier. Especially with type 1 diabetes or all diabetes, there is just so you're making decisions all the time. So this hopefully some of these tools will help make that just a little bit easier for you. If we think about continuous glucose monitors, we've got this little sensor that's on the back of our arm. It can show us, exactly what's going on. They're going to take your blood sugars every minute to every 5 minutes, kind of give you some good insights as to patterns and trends, versus when we use just a finger stick, which there's nothing wrong with using a finger stick, and we still need to use it even with a continuous glucose monitor. We just kind of know what's going on in that moment in time. And then every time you want to know more information, it is getting that glucometer out and, getting, it takes a minute to wipe your finger, put the test strip in and check your blood sugar. But nothing wrong with doing that. We still want to do that with any signs and symptoms, but the continuous glucose monitor is going to give you that feedback consistently. From from a dietitian's point of view, what are the advantages of continuous glucose monitors? Again, just kind of like I kind of touched on here, it lets you know discreetly sometimes what's going on. You can go out to dinner, you can order your food, you can check and see what your blood sugar is by just taking a quick glance at your phone or the reader, and then kind of make those decisions. Do I need to dose any medication or insulin to cover this meal, or can I just go ahead with it and proceed as I would? Same thing with things like exercise. Like I'm getting ready to take a walk, so I can just kind of quickly glance and see what my blood sugar is. If it's at an appropriate spot, I can go ahead and kind of hit the road. So when it comes to exercise, diet, sleep, all these things, we can look at our blood sugars very quickly and just know what they are without having to, get out everything and clean it, wash our hands, et cetera, et cetera. So hopefully, looking at the different continuous glucose monitors, we have the sensors that go on the back of our arm that can be used either with a reader or a phone, which again, they give us the trend arrows, depending on how much technology you want to carry with you, they can give you, those insights very, very quickly. A lot of the new continuous glucose monitors apps also have these AI pieces where you can take a picture of your food. It can give you, some of them can give you a little feedback of what to expect. The other, sometimes it's just like putting that food in there, the amount of carbohydrate with it, and then you can look back and see what happened with that meal. So again, I just, it's super exciting of all the things that you can do with the continuous glucose monitor besides just check your blood sugars now. So they're going to estimate what your A1C is. They are going to tell you what your blood sugars are. There's just so many things that we can do with them. Give you more confidence, less guessing, makes clearer patterns and, just let you kind of see what's happening there. All right, I'm going to move forward here. Before we talk about pumps, I just want to talk, I want to circle back there. One other continuous glucose monitor. So we have the sensors that go on the back of our arm or someplace on our body and other, in some cases. There is also an implantable continuous glucose monitor. So this is good for a year. So you have a very minor procedure done in the doctor's office. It has to be a provider that is allowed to do the implantable CGM. So this little sensor is placed under the skin, and then there is a reader that's over that you can take on and off that is going to check your blood sugar. So this is done once a year. Used to be, I think initially they were 90 days, then they went to 180 days, but now we have this sensor that's good for a year. And there is like in the pipeline, and there is some approval where this particular implantable continuous glucose monitor also is now able to sync with an insulin pump. So it would kind of take away that piece of changing your, continuous glucose monitor, whether they're anywhere from 10 to 15 days now. So depending on which continuous glucose monitor, you would be changing it, you wouldn't have to. You would just have this sensor under your skin that would, kind of take that place there. All right, I am going to back up and then just kind of a quick overview of insulin pumps. So again, this other technology that is available for anybody that's on multiple daily doses of insulin. And to make your life a little bit easier, this insulin pump is available that will mimic how the pancreas works. It's going to release insulin, in small increments every few minutes to mimic that basal insulin that your body produces. Or if you are doing multiple daily injections, you kind of think about this as your long-acting insulin. Example would be Lantus. So when you take your Lantus, it's lasting over 24 hours. Your insulin pump is going to mimic that action by just giving you small doses of insulin, throughout the day to kind of keep that blood sugar nice and even. And then you have the ability to bolus with your meal. So you're just, pushing a button basically, depending on the kind of pump you have, it's either going to be, based on the number of carbs that you have eaten, or it is going to be, based on, the meal size. So it can be set up differently. I always like to think of insulin pumps on a spectrum. There are some that allow you to do many things. Like, so you can, change the insulin carb ratio, you can change the basal rate, et cetera, to, some that are pretty simple. You're basically putting it on, you're putting a little bit of information in there, and it's off and running, and it kind of gets to know you and you get to know it. And so, when you are shopping or considering an insulin pump, you just want to be mindful that there are different things there. Of course, some of the decisions that we think about, are factors that you want to think about is like use of a cell phone. Some of them everything is operated from your phone or a little personal device there. Others are operated right from the pump. So, how attached do you want to be to certain technologies? Continuous glucose monitors. So you may have a preference. There are a couple different ones out there. So you may have a preference of which one you love. So you may, as you consider a pump, you want to make sure that if you're not willing willing to change continuous glucose monitors, you want to make sure that your continuous glucose monitor that you know and love is communicating or able to communicate with the pump that you choose. Remote sharing options. Some allow remote sharing options, some don't. And sometimes when you're using the continuous glucose monitor with certain pumps, you can't share just the continuous glucose monitor option. So, I think about this for kids or older adults that are other people are monitoring to help them manage or so to get those alerts. So we just want to make sure that those remote sharing options fit into your lifestyle. Size and shape of the pump. Some of them are very small. Some of them, attached to the skin without tubing, and we'll, kind of talk about the differences there. So, if can fit it in your pocket, if how much tubing there is, what kind of infusion sets are available. So there, lots of different things to think about, and again, sometimes it comes down to insurance coverage, but, these are things when your pump I'm going to use the word shopping, kind of loosely. You want to make sure that you're thinking about the size of the pump, how you are bolusing and with the pump. Are you doing it with a phone or with a reader or from the pump directly? And which is best for you? How customizable the pump is. Again, kind of on that spectrum. Lots of things can be adjusted on some of them. None can be adjusted or very few on some of them there. So kind of choosing the pump that works for you. I always think about somebody with long standing diabetes that has been doing multiple daily injections for years. They know a lot, you know a lot, you're used to doing a lot. Do you want to continue that or do you want something that's a little simpler? So that customization, what works for you. Again, the insurance, probably the number one thing would be cost and insurance coverage for most. But, again, if you have options, making sure that you're choosing what is best for you. The size of the insulin cartridge, some of them hold, you want to make sure that you can go 2 to 3 days without having to change that cartridge in most cases. Some of them are able to use more concentrated insulin. So, depending on the amount of insulin that you use, you want to make sure that you pick a pump that has a cartridge size that is appropriate for you. And again, your physician and your diabetes care team is often going to help you with all of these decisions, but just kind of giving you some ideas to think about. And then when we talk about like a tubed versus a tubeless pump, some of them have that infusion set that goes into the skin, and then you have that little tubing that comes off of it that goes into the pump to feed the insulin. Others are tubeless. They're going to attach right to the skin. Like this picture here, this particular pump is, there is no tubing. It goes right onto your body and that's it. The infusion set is already, is on the back there. You are not taking this off until, after 2 to 3 days when you're ready to change, and then you're putting a whole new pump on there. So again, thinking about what's best for you. We talked about the implantable CGM. Again, just kind of reiterating how this technology can help support nutrition. Again, these AI features now are, it's going to change. Like I said, super exciting time. It becomes easier and easier. You can take a picture, you can enter in what you're eating, you can tell it how much insulin you're taking, and some of the guesswork. I like to call it the art and science of diabetes care. Like there is a science behind it, but then there is the art of your own body. Like I always think about, I always tell my clients, nobody knows you better than you. If a situation is different for you than it typically is from a scientific standpoint, then, these tools can help you manage a lot more. Again, just reducing that stress work, less what if thinking, feedback in real time or within minutes. Fewer surprises, greater confidence in your choices. If you do something different, if you travel, if you are changing time zones, things like that, it can help make your management a little bit easier. Progress over perfection with these tools. Yes, technology supports real life, but it's not perfect. It fails. Sometimes, infusion sets come out, internet disconnects, things don't go exactly. So you got to remain calm. You have to have a backup plan, just focus on what you already know if this technology fails you temporarily. So if your blood sugars are going up unexplainably, making sure that you're checking your infusion sets, making sure that everything is in place as it should be. And then just like rolling with it, it's just like anything, we have to take technology for what it is. There are just sometimes it's not going to work 100%. So we're just going to, kind of drop back, do the best we can, and then kind of get everything rolling again. Personalization is a key role. So again, making sure that you are personalizing these tools to work for you. All right. So all that being said, I am going to turn over to Allie Baker, and she is going to tell us a little bit about her journey with type 1 diabetes and kind of why what happened, why she chose what she chose, and why it's working for her at this moment in time. And hopefully she'll always be open to change if she needs it. All
Yes.
right, Allie, I am going to turn it over to you.
All right. Thank you so much, Beth. Yes, my name's Allie Baker. I'm on the CoreVantage team here at Edwards, and I'm just here to share a little bit about my journey and how my diabetes management has evolved over time. So I was about 25 years old when I was in the ICU with DKA, finding out that I was a type 1 diabetic. If I'm being totally honest, I really started from the bottom. I didn't know what diabetes was, what it entailed, how to take care of myself. Really definitely didn't know how to count carbs either. So I was there for a couple of days and, I had met with quite a few doctors and we went over, just the general gist of carb counting. And I felt like while I was leaving that I was still very unsure of how to take care of myself. I initially started off on daily injections and pricking my fingers. I was on a sliding scale giving myself insulin, so I had experienced quite a few lows, just overall feeling like my diabetes was unmanageable, unpredictable, and it was really difficult to manage. And then I started to learn a little bit more about counting carbs and then moved to an insulin to carb ratio, gaining a little bit more knowledge there. It was still at a point where I felt like my diabetes was taking so much time, effort, and mental energy, just still stuck in feeling that everything was so overwhelming. And then I finally transitioned to an insulin pump, which things began to shift for me. It was so nice having my insulin pump, being able to calculate the correct amount of insulin that I needed to be giving myself. And absolutely having a CGM gave me so much peace of mind. I started to really kind of level out a little bit more. And my favorite thing about wearing a CGM was that it would give me an early alert before I went low. So I kind of transitioned to this place of feeling a lot more confident and safe. Um, and I definitely appreciated too having it just right on my hip. It was so nice to not carry a backpack around with a whole bunch of different supplies. So that made it more convenient. But I did get to a place where I was also not moving forward enough with my A1C goals. I was just kind of stuck at the same spot for a while. So that's when I kind of decided, okay, I'm going to start really taking more of an active role with my diabetes, try to, change the direction from where I'm at. And that's when I started on a tubeless pump. So that's what I'm currently on. I absolutely love it. I mostly control everything from my phone, which is so nice. It's really discreet, which as a younger woman, just even with, picking out clothes to wear, um, just a decision like that, it makes things so much more manageable. I finally have hit my A1C goal. I'm actually doing better than I ever really imagined that I would have. Um, and definitely have educated myself more on what I should be eating. So it was a combination of figuring out, well, what works best for me, um, nutrition, and just a combination of all those things to make diabetes feel more manageable, sustainable, and empowering. So that's a little bit of where I've been at and where I am now with my journey with type 1 diabetes.
Thanks, Allie. So helpful, and it's just like, in real life, just kind of like why you chose what you chose and, just kind of always being open to, something different if you need to. So, just some key takeaways today. Technology can reduce that mental load. And I think Ali is great, kind of a great explanation of how that, it's like you're not all the time, there's some things that kind of are taken care of for you. The continuous glucose monitors provide us some trends and not just numbers. So it kind of helps you get to understand how your body reacts to things. And then I always, sometimes you think you got it figured out and then it acts differently. So, but, and pumps offer some flexibility and consistency. Nutrition decisions become more personalized. We can only give you cookie cutter information to start. You have to take that information, excuse me, and tailor it to yourself there. So it's like, yes, like I said, there is the science behind it, but we have to, we got to get that art piece down there. And again, technology supports, but it doesn't, you can't expect perfection there. Appreciate your time today. This is just, a couple things. If you have additional questions, we have this Ask the RD at MYE, My Edwards Healthcare Services. I always say, you can always put the question in. We'll get back to you as soon as we can. You can reach out to Edwards, obviously, when it comes to supply questions and questions in general. So there's both their website and their phone number. So hopefully those resources will be helpful for you. Also going to share some references there. There's just, I mean, we all have access to, or most of 99.9% of us have access to the internet now. So there are great resources out there. So, kind of making sure that you're keeping up on that and, checking in. And if you need to make any changes or anything, there's lots of options out there. But again, like I said, technology very exciting right now. There's lots of things. So, always kind of keep your eyes open, something that's working for you now, if it's not working for you, there may be a better option. So, look for it. Hopefully look forward to working with you in the future here. So thank you for your time today. Much appreciated. Allie, thank you.
Thank you.
And everybody have a great day. Thanks.